Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that is all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine and serve as the Chief Medical Officer of Nudge Health. Each episode delivers 5 key takeaways from leading experts, innovators, and practitioners on how lifestyle medicine is reshaping the future of healthcare through practical strategies and real-world success stories. We empower you to make a lasting impact in your practice, in your organization, and beyond. In this episode, we're honored to be joined by Dr. Kristi Artz. Dr. Artz is the Vice President of University Hospital's Connor Whole Health. She most recently served as the Medical Director of Lifestyle Medicine at Corewell Health based in Grand Rapids, Michigan. She's board certified in lifestyle medicine and emergency medicine, a certified specialist in culinary medicine, and a board member of the Board of Directors for American College of Lifestyle Medicine and the National Board of Health and Wellness Coaching. Dr. Artz earned her medical degree from Wayne State School of Medicine in Detroit and completed her residency in emergency medicine at the Hospital of the University of Pennsylvania. She holds a master's in population health from Jefferson College of Population Health. Welcome, Kristi. How are you doing today?
Great, Padmaja. Thank you so much for having me.
What a pleasure. I'm glad you could join us today. So let's start at the beginning. What drew you to lifestyle medicine and how did you first get involved?
Well, as you mentioned in my bio, I'm an emergency medicine physician. That's my original training, and I worked in emergency departments throughout the country and actually even internationally for about 20 years. And through that work, it gave me a lens into chronic disease as well as acute care, of course, but recognizing that oftentimes I was seeing and taking care of patients that had we been able to meet them earlier in their healthcare journey or perhaps intervene in a more proactive, lifestyle-focused manner earlier on in their healthcare journey, the outcome may have been very different, and perhaps maybe I wouldn't even be seeing them in the emergency department. And so through that experience, I became very curious about everything I felt like I hadn't learned in medical school and even in medical training. And of course, great schools, great training programs. But there's so much to know, and there's so much science, as we all know, around and evidence for lifestyle intervention that right now is still not core to medical training. Mm-hmm. And getting interested, getting curious, I really found my way first actually to culinary medicine and did training and certification. Food as medicine was a topic that was of great interest to me, and I had some opportunities to mentor under some really great physicians that were in the sort of wider Philadelphia area at the time when I was practicing there, and followed that with certification in lifestyle medicine. And that's where everything really came together for me as a physician, was this mechanism, this umbrella, if you will, that lifestyle medicine not only incorporated all of the nutrition and food as medicine strategies, but also all the other pillars that, working with and counseling patients and using them as treatment strategies. As you well know, we need all of these tools, and we need to have, competencies in not just one of the pillars, but a way to really engage our patients in conversations in all of these different aspects of their health.
Yeah, well, I didn't know that it all started with food as medicine first. Mm-hmm. How did you learn about ACLM?
It was, let me think. Well, fact is I actually am the first board certified lifestyle medicine physician in the state of Michigan. So where I started
Wow.
my lifestyle medicine sort of growth within health systems. So I'm proud to be able to state that perhaps I had a role to play in bringing lifestyle medicine within at least the region that I still live and practice in. But lifestyle medicine, the first conference that I attended was back in 2017. And I hear this from many colleagues within the American College is that the moment that we enter into that space, you feel like you found the people
Yes.
you've always been looking for and sort of the way to practice, the tools that could improve our clinical practice. And it all comes together in that moment of clarity. And certainly that's what happened with me.
Yes, yes. Everyone would say, well, I found my community for sure.
Exactly.
The common sentiment. Yes. So, how does implementing lifestyle medicine help a clinician develop new skills beyond clinical care, such as strategy, marketing, or financial planning? Because you were able to successfully establish a lifestyle medicine center at Corewell Health. So, tell us about your experience there.
Yeah, and that's something I feel like I underestimated back in 2017 and having an opportunity to begin to work on strategy and visioning and the business plans. And again, throughout medical school, we get so much wonderful training and a
Yeah.
diverse group of topics, but it was something for me personally, I felt like, wow, there are skills that I need to learn out of necessity.
Yeah.
And fortunately, being in a large health system at the time and currently now in an academic health system, being able to learn from individuals, whether it's in the strategy and innovation space, whether it's in marketing and communications, whether it's in finance and business planning. But I have found that working with colleagues throughout the health system, not just our physician, and peer colleagues, but within all of these other domains within health systems, allow you to take what you know around the evidence of lifestyle medicine, the clinical practice side, and understanding how we can advocate for our patients in a different way, and then
Mhm.
translate it with these new skills, whether that's strategic thinking and alignment, so that you can grow perhaps a new department. And like you said, I founded the department at Corewell Health, and we grew that over a number of years. But it took a team. It
Yes.
it requires all of us coming together, but being able to communicate the vision first
Yes.
and how it really aligns with system initiatives or patient experience, for example, or there's a number of different ways you could perhaps communicate it depending on the perspective of the audience that you're working with.
Yeah, yeah. I would say somehow lifestyle medicine journey prepares you with this. I could say for myself as well as you, if I had not found lifestyle medicine, I don't think I would be doing what I'm doing right now. So I think it's somehow those who really become champions in lifestyle, I think you are forced to create that space and development because you now found that passion and you learn across around in your journey to say, okay, how do I make a business case around this? How do I communicate more effectively? How do I make the case? So yes, all of us are sort of in this journey become that champion, but that's all thanks to a lifestyle medicine journey. So I couldn't agree more there. So when it comes to learning from our colleagues, what have you learned from those who are around, lifestyle medicine world, but they're not necessarily in Michigan, but they've built some successful programs? How that has influenced your work?
Yeah. Again, even starting back in 2017, going to that first conference and now we're here almost in 2026, and the colleagues that I see year over year at the annual conference, for the American College of Lifestyle Medicine, there are certain colleagues that I feel like we grew up together in lifestyle medicine, and I see them really as the people that inspired me to create. And I would say a lot of us feel like we are entrepreneurs, we are innovators. We have that drive and that passion and the purpose for what we're doing, but we also have to match that with skills for execution, right? We have to be able to really, put the plan into practice. And colleagues throughout the country, and truly, I would say anywhere across the country, there are colleagues that I can point to that they had a meaningful impact for me personally, professionally. They were my champions, my cheerleaders, my mentors, my shoulder to cry on, whatever it was.
Yes.
So I can't say enough about that network that you can develop through meeting, these champions and peers within the American College, whether it's through member interest groups or committees that you get involved with, or just those moments of connection for shared energy around a project that you're pursuing. Even just recently, I invited a colleague that, I've probably now known for a decade or more that's at a different organization. And he was incredibly helpful and supportive in helping us at university hospitals in Cleveland to really help us grow and rethink our group medical visit model or our shared medical appointments. And so even things that I've done a lot in my past, it's always great to reconnect with our peers, our colleagues, and say, hey, what are you seeing? What are you finding? How can I do this better? Show me what you're doing. And I always walk away with a very, probably a handful of useful skills, tips, tools, or someone else I need to reach out to and, just be curious and ask more questions.
Yes, yes. And I think we're all very generous in terms of sharing our
Yes.
experiences, our expertise, knowledge, what we have gained over a period of time. I think that's the unique community we have here built at ACLM, right? Everyone is willing to give their time to make sure that you don't have to reinvent the wheel. Oh, here we have learned to that's the beauty, and I'm glad you highlighted that part. So how do you connect your lifestyle medicine work to the broader vision and mission of your health system where you work now?
I would say that's a really important concept for anyone, particularly if you're in a health system environment and there's a lot of competing priorities, and trying to start something like lifestyle medicine can feel like a very uphill battle. However, when you look at a lot of mission statements, for example, at university hospitals, the mission statement is to heal, to teach, to discover. And you match that with a vision statement or what, we as an organization hope to be. And at university hospitals, it's advancing the science of health and the art of compassion. To me, that speaks lifestyle medicine. And perhaps I have a bit of a myopic view, but I also think most organizations are seeking this opportunity to improve health. And what better way or what better strategy could we use than lifestyle medicine? It gets to the root cause of what drives this chronic disease epidemic. We now have, many implementation models that have proven to be successful. We have outcomes data that show, patient improvement, quality of life improvement, cost effectiveness to the care. So I think no matter what vision or mission statement an organization might have, there certainly is a way to align the goals of lifestyle medicine in a very meaningful way. And, to anyone who might be listening that is beginning their journey in a health system or maybe in a big organization, find out what your mission and vision statement for the organization and really connect that in a way, again, whether it's to your senior leaders that you're meeting with, or even community members, it's an important way to communicate why lifestyle medicine is so impactful.
Yeah, yeah, great. I think aligning your vision with the bigger, broader mission is such an important part. I think many lifestyle medicine passionate clinicians get stuck sometimes because they have their own idea of what they want. And sometimes we have to just be very creative around that. So, yeah, I couldn't agree more that. Tell me more about networking within ACLM, how that has really helped you in creating lifestyle medicine initiatives or programs or just professional growth.
Yeah, I think it goes back to, again, some of the implementation models, and I think that's where my sweet spot is. I've discovered over the years is some of us are great researchers, some of us are fabulous clinicians, some of us get really into the details of clinical workflows and putting it into operations. And I would say that's where I feel like I've tried to develop my skill set. I'm interested in the doing part. I think most of us are, but it's a lot of grit, and persistence and perseverance and understanding where the barriers are and communicating effectively across, domains, again, within large organizations. And, with support or learnings or peer networking through the American College of Lifestyle Medicine, I think you can always find an example that's similar enough to either a success that you've had or perhaps a challenge that you're experiencing. I honestly probably can't think of a time where, I'm like, nobody has experienced this and I can't learn, because there's always a colleague that I've been able to uncover or network or just, have a conversation with. And even most recently, we've been excited at university hospitals to add two new advanced practice providers, a nurse practitioner and a physician assistant to our team. And through that process, I reached out to one of the member interest groups where a lot of the APPs, join on a regular basis, and was able to peer match or mentor match the new APPs on my team at university hospitals with others within the American College of Lifestyle Medicine. And again, just feeling that support from a network of people that are trying to do what you're doing or already have done that, I think just it's just so incredibly meaningful. It really you're already pointed in the right direction, so to speak,
Yeah.
with lifestyle medicine, but it just gives you a little more traction that you're taking the steps that are going to make a difference, whether it's in patient care or new ways of delivering care that you're trying to implement.
Mm-hmm. Yeah, so tell me in closing remarks, what advice would you give to medical students or residents who are thinking about lifestyle medicine? Why should they pursue that, as part of their training?
Well, since, you and I and many others, we've been part of the American College of Lifestyle Medicine for many years now, and so grateful for all the experiences. And like you said, you find your people, your tribe, your, whatever word you want to describe it. So I think when we think about longevity within medicine and the practice of medicine, the number of times that I've spoken with people who they have that glimmer of hope when they find out about lifestyle medicine, and whether they're early career or later career. There's actually a new physician on my team who is OBGYN certified, late career physician, who is so excited to be part of our lifestyle medicine team and sharing part of his clinical time between those spaces. So that's the other thing I would encourage people to consider. It's not in all or none, because the beauty of lifestyle medicine is that it crosses all these domains of care in clinical practice. And while you might not know exactly how you're going to make this all work, so to speak, in your personal career, have faith that you'll figure it out along the way. And through, being a member in the organization, finding your peer colleagues that you can connect with on a regular basis, and just continuing to learn and be curious, you'll figure it out along the way. I would say it can feel frustrating and, again, feel like an uphill battle at times, but you'll find your way to connect your purpose around lifestyle medicine and be able to work with the populations of patients that you're seeking to bring this care to. So,
yeah, well said. Well, thank you, Kristi. While we're out of our time today, I really appreciate your engagement and for sharing your passion and expertise with us. It's been a true pleasure having you join us on the show. And thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you've enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring healthcare leaders and clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.